The content provided in this video is for educational purposes only and is not medical advice. For medical advice, please schedule an appointment with one of our Hope for Healing providers or the appropriate medical professional. This material is the property of Hope for Healing and is not to be shared or replicated in any way without written consent. Thank you.
Welcome, everyone. Thank you so much for joining us. And thank you, Dr. K. I know with the school year getting started for some of us, and some of us, I think, are getting started next week, this question of how to support your neurodiverse student is one is coming up in people's minds, and knowing that they're going to have to answer that question. And so we are so grateful that you have going to kick off the year with helping us, Dr. K, to help to support our children who are on the neurodiverse spectrum. Okay, so we're going to kick things off with this question, which I thought was absolutely brilliant, which is, I have gone to conventional medicine my whole entire life. And when I took my child to conventional medicine, they received this diagnosis. And I'm going to split this into two questions, because one person has said, hey, I think my child may be on the spectrum, but everything says they're not. And this other person says, I received the diagnosis for my child, and I did not like the outcome of what they're saying that we're going to be living with. So can you kind of talk into that?
Well, in order to receive a diagnosis of autism, it's meeting certain criteria, but I would say to the parent that has this gut feeling that something's not right, to continue to lean into your own intuition, that even though when you had your child evaluated, they did not meet every little box to say, yes, they're autistic, but there's something not quite right. Keep pursuing that, because there's a reason for that. And mothers are very, very intuitive. And it's just what's given to them when they carry a child and or even adopt a child from birth. You have them and you know something's not right. So in order to receive a diagnosis of autism conventionally, or with Western medicine, allopathic medicine, and everything that I was taught, it's a list of criteria involving certain developmental milestones. And typically there are problems with personal, social, interactive development and speech, but you can also have other delayed milestones in gross motor, fine motor, etc. Now, the conventional approach is you see your primary care provider. There are ages and stages questionnaires, Bright Futures, something called the MCHAT, Modified Childhood Autism Toddler Questionnaire. And if it's suspicious for autism, you're typically referred on to pediatric neurology, clinical psychology, a diagnostician, or a developmental pediatrician. They spend quite a long time observing your child and complete certain types of questionnaires. It's something called the ADOS or the CARS-2. And then they say, yes, indeed, your child is autistic. Now, the only therapy typically that is currently accepted that shows improvement with evidence to back it up is something called ABA therapy, Applied Behavioral Analysis. And it is a systematic way to approach a child with autism, and it involves attending that and having a routine. But if your child also shows signs of encephalopathy is a change in the way your brain functions, especially when, and this is in the medical literature, mainstream medical literature, and it's not across all children, but many, when they are 12, 15, 18 months old and they receive a partial live virus vaccine, they develop a fever, maybe seizure activity. There's a connection between a potential link between mitochondrial problems that lend to the diagnosis of autism. And in that case, especially if fever is developed, loss of milestones, the current standard of medical care is to obtain an EEG, electroencephalogram, to make sure your child is not having subclinical or overt seizure activity, to do an MRI of the brain to make sure that they're not missing certain critical structures of the brain, and also to do genetic testing, not what we do here at Hope for Healing, but something called Fragile X testing and a chromosomal microarray. And then if those come back positive and concerning, then that may be where the parents are genetically tested, and along with the child even further. So that's the current standard of care.
Okay. And when you say current standard of care, meaning that's kind of where it stops? Like that's
Yes. So basically, they tell you your child is autistic. The only evidence-based therapy that will help your child is to go to ABA therapy. Doesn't matter what you feed them, doesn't matter what they're around, doesn't matter what they do, how often they poop, how well they sleep, that they have autism. Go to ABA therapy. That's all we can do. Get your affairs in order. And they don't tend to offer anything else.
Right. So, and that's where kind of when we see people come in or when we talk to people at events, they're that it's almost an easy thing to understand why they feel so helpless and why they have so many questions. So, we're going to hope to touch on a few of the questions very much specifically around like students and education and learning and behavior. But can you go a little bit into how we're going to look at things differently and how overall, and maybe just kind of bullet points of overall what journey we're about to go on, because we do look at things differently than an allopathic or conventional way of doing things.
Yes, and I'll try to keep this pretty succinct, but there is not one child in the world like your child with autism. So how dare we have a cookie cutter approach? So when you come to Hope for Healing, we're going to take a very detailed history involving preconception, your pregnancy, the method of delivery, but also family history, occupations of mom and dad, where they lived geographically growing up, what the grandparents did and where they lived geographically growing up. Because what if a toxin issue like, oh, I grew up around open coal mines and X. So then we will want to know if your child has had an MRI, an EEG, Fragile X testing, chromosomal microarray. If they have not, we're going to order that because it is medical standard of care. Most commercial insurances pay for that. There's financial aid for that. But then the thing that sets us apart is, in addition to taking this very detailed history and listening to what mom and dad observe and family members observe, and it's these extensive questionnaires. People are like, I've never had to fill out so much stuff in my life. Like, well, we read it all before you come. I read every form and every note in the portal. Now, if there's a lot of records, we may ask additional for me to go through those records. But then we create the timeline, and then we hear from you as to, did you notice something from the very beginning, or was there a point where something happened? And that's what we're going to key in on, those subtle changes, and listen to you. Then the thing that we do is we do precision genetics, which are not looking for a part of a chromosome that's missing or a part of a chromosome that's added or a syndrome. We are looking for actionable systems that we can do something about. So those genetics lay the foundation. And then when we draw labs, you may not know this, but it's extremely common for children with autism to have very low cholesterol. And what if they don't have the raw material for their adrenal gland to work? So we do a very in-depth comprehensive physical exam. It's called a nutritional physical exam, where we're looking at the nails, the hair, the skin. We're looking for weird birthmarks. We're looking at genitalia. We're looking to see if there's evidence of infection from all kinds of things. Children with autism very rarely show signs of infection. In fact, we celebrate it when they have fever. So then if there's a history of toxins, we may begin with doing urinary provoked heavy metal testing, or we may wait on that. We may wait on the gut, because if we can lower inflammation throughout the entire body, a lot of the gut problems will go away too. So we're looking at blood-brain barrier attack, like looking for brain encephalitis. We're looking for these infections like Lyme disease, Bartonella, Babesia, which is actually very common in Texas with deer ticks that carry Lyme. So we're peeling the layers of the onion, looking for other causes, and wanting to give your child what they need and take away what they don't need in order for them to gain balance to their immune system, lower the inflammation in their brain and their body that's causing them to show up with signs and symptoms of autism.
I really love that you said, and in the way that you kind of unpacked, because that's so much what we do here, which is like pulling back the layers. So the question I have, because you use this word a lot, is when we think of the word inflammation, we think of swelling, we think of a visual representation that something is wrong. Can you talk a little bit about how it's not always a visual thing, and how a lot of that inflammation, especially for children on the spectrum or children who are neurodiverse, it's a lot of internal inflammation that we can't see?
Yes. So when we typically think about inflammation, think of a bug bite. It's red, hot, swollen, painful. Your child cannot unzip their brain and say, look, mom and dad, my brain is inflamed. How does that show up? Global meltdowns, stimming, sadness, banging their head against a wall, rubbing their head, moaning, repetition, stimming, doing obsessive compulsive behaviors. Like if their cars are not lined up this way and you try to remove them from that before they finish the job, they have a meltdown that's not commensurate with, hey, let's put your jacket on and go out the door. So that's inflammation, stimming, pain, constipation. I mean, and bumps on their skin, marks on their nails. Things are out of balance, but rubbing their belly up against furniture, trying to relieve pain, maybe squatting down on the ground, stimming, rotating, spinning. Those are signs of inflammation. But temper tantrums, anxiety, crying fits, global meltdowns, it's not a character deficit because you as a parent can't parent them properly. So stop that right away and just quit the blaming. That's
Right.
what
I
we
love
want to
that.
do. It's what's going on in your child's body. How can you identify that inflammation? Well, look at them. If they're hitting their head, if they're crying, they're stimming, they're sad, they're lashing out, they're hurting other children, they're showing remorse, they're hitting, they're biting, they're running away, they're acting fearful. That's brain inflammation.
Right. And I really love that you break that down, because I do believe so frequently when stuff like this happens, or especially if it's like sudden onset, we had this perfectly, like, they were meeting their milestones, they were um, communicating, and then all of a sudden that switches, or all of a sudden their behavior is scary or erratic. It can feel like, where have I failed my child? But so much of what we see and learn is that there's so much you can do to support your child, but this isn't a character deficit on you as a parent. And I think that's so encouraging to hear.
And I think too that when parents suspect something and they take their child to a doctor and they're not heard, but in their gut, their heart, they know something's wrong, then you're like, I did what I knew to do. You dotted all your I's and you crossed your T's, but you weren't heard. So I think that's something that sets us apart we believe you. You don't have to try to convince us. We believe you. We're not going to doubt you. So I think that is something that's very disarming and comforting to parents. But also, if we as practitioners think that something isn't right, even though you're very well read, I won't stop until I feel like you've heard me, because I'm trying to figure it out. And we found that many a time where I've requested a certain lab and there's been resistance, or no, they're not sick, and then their throat culture comes back positive, even though there's no signs or symptoms. It's that after a while, you start to tell something's not right, and you see these patterns emerge. And so we want to partner with you as parents and grandparents to know that we believe you, but we also, it's a collaboration. We're working together. So just give us the benefit of the doubt to work with you too.
Well, and then ultimately in the long run, teaching them those signs and symptoms, right? Teaching them the things that like no one is readily teaching people right now, is to go, oh, we think this is strep throat. And it's like, but it doesn't look like strep throat. And we're like, we do know that. And so now we can kind of show you, hey, notice this. When your child starts to behave this way, we can start to give them tools to get them ahead of the game, which is exciting, and to be able to partner in this way, because they will tell us things that we're like, oh, wow. Like when they start to open up and share with us, then we can go, okay, this is your child saying this. So like we get to be almost like a translator in the mix of things. So I really love that. Okay, so you touched on the traditional genetics that they go through, and then you did touch a little bit on precision genetics. Some of these questions that are coming up, I know ultimately will lead to precision genetics. So I just like to set a baseline of understanding and definitions of, so what is precision genetics? And then what are the main pathways we kind of look, or systems we look at when we are dealing with children who are on the spectrum?
Well, precision genetics changed my life. I used to weigh almost 300 pounds. I took antidepressants off and on for 27 years. And when I found out how I was wired, it changed me. And that's why I opened Hope for Healing. And so you can understand that there's a personal motivation there. And then with lots of family members, and when I was a child, I was thought to have juvenile rheumatoid arthritis. One of my children does have that, but no one had any answers as to why. So precision genetics involve a cheek swab. This is not something that's sent to 23andMe or Ancestry.com. This is a private lab that your information is protected. It is not sold. Okay. So that's a misnomer. That's a misconception out there. Like, and if you don't want to use your child's biological name or your own, you can use a pseudonym like Daffy Duck or Snow White or Bugs Bunny, so that no one has to know your genetic information. Our practice does, of course, so we can deliver those results to you. So no, it won't be sold. Second, it's looking at systems in your body that you can do something about. I don't really care where you're from. I don't care what the chances of your children having blue eyes are, and that's not what's on the test. But what's on the test is how we can give you as a parent tools to lower inflammation in your child's body. That's the first thing. When your house is burning, you put the fire out. So we're putting the fire out. Second, how to take sugar from the food that you eat, not bad sugar, not inflammatory sugar, but good sugar from fruits and vegetables and meats to pull that from the bloodstream to get it into your cells, so that your cells can clean themselves out and so that your cells have energy. And what's the biggest organ? The retina uses more sugar than any other organ in our body every day, because you got to see, but the brain, the lungs, the heart, the nerves. And when your child has difficulty processing and gets hangry, and you see that, oh my gosh, I got to feed them every 2 to 3 hours or they're going to go freaking ballistic, or you see them getting antsy, that's called autophagy. That helps with speech. Then there's detoxification. If your body can't, if the liver, the kidneys, the skin, the lungs don't work right, you can't sweat out, pee out, poop out, or breathe out your toxins. So we want to give you tools for that to happen. And then how to give energy to every cell, but especially to the mitochondria, and also to recognize what essential vitamins and minerals and hormones that your body or your children's body may or may not make. Because there's a lot of essential vitamins and minerals, like the fat soluble ones like E and A. You can overdose on those if you just give them. But how about we identify them so that you can know exactly what you need? These don't change. These are hardwired. From A to B, there's an enzyme. You can only make so much. So these are hardwired. They never change. You do it once, and you have that gift of being able to know. And even if you have children who are neurotypical and you have a child that's neurodivergent, autistic, or delayed in any way, you're able to prevent these things in your other children. And it's a throw of the dice between mom and dad what your child gets. So that's a deep dive, a brief overview on our genetics.
So at any point when we talk about precision genetics, these are one of the systems we're talking about, or one of the points of education that we are trying to touch on, and where ultimately our providers, if, and you can correct me if I'm wrong, but ultimately where our providers pull insight from when supporting children on the spectrum, or supporting any child or adult who has their precision genetics done.
Yeah, in fact, in well checks, we blow into the note, we put in the note the genetics, and then a brief review. Are you using this? Are you using that? And a lot of times you're juggling all these things. You don't remember the importance. And if it's been several years, it's really good to do a brief overview, because metabolic needs. So what was true for a 2-year-old is not true for a 6-year-old as far as the amount that's needed. And especially beginning at about 8, there's a rapid increase in needs of certain vitamins. So those precision genetics should be reviewed, and our providers look at that. So if you come to a well check and you go, oh, Johnny's fine except for a little bit of eczema, that's a big fat red flag for us as providers to go, okay, how are you modulating the inflammatory markers and the detoxification? Where can we help you and partner with you and remind you that certain things act together like puzzle pieces and are synergistic?
I love that. Okay, so we're going to get into some of the subcategories of that. One of the things I didn't mention, though, is that if you, as a participant, are joining us, you can go into the Q&A section and drop any additional questions. The topic we're going to dive into first is the diet. So a healthy diet is incredibly important. And what I've loved about reading so many of your questions is that y'all believe that too. And y'all are just trying to figure out the odds and ends of like where to start. So let's start with something that is important, like hydration. So we understand the importance of hydration. We understand that it's so necessary. But what do we do if drinking water is not a strength for my child, and we know that we need to have it happen? So what do we do? How do we support them in that way?
That's a great question. A lot of people don't like the taste of plain water. So the herb stevia is extremely sweet, and not all stevias are the same. But it's important to not use a lot of carbonated beverages most of the time, because actually the carbonic and phosphoric acid can leach out calcium and phosphorus from the bone. But a little splash every once in a while is okay. So a lot of times using a fruit or a vegetable infusion, like taking a cup and doing like fresh red raspberries or frozen fruit in there to make it taste a little bit better. Now it can clog up a straw or clog up a sippy cup. So you may want to, filter that. But using a fruit infusion, you can also do like cucumber or lemon or lime water, pomegranate water. And, then if you want to do a little tiny bit of stevia, we carry one here in the office called Nutrimedic stevia. And stevia is antimicrobial and antibacterial, and it breaks apart things called biofilms. So just a dot, not a lot, just a drop, and to taste. And so those are ideas. The other thing is that depending on what's affecting your child, a little bit of honey, a little bit of maple syrup, a little bit of date lady substance. There's a woman called the Date Lady, and she's made chocolate syrup, barbecue sauce, and a type of a ketchup out of dates. And those naturally occurring things are helpful. So another thing that you can do is don't give them a big, huge honking glass. Just do something small and make it a game. And about every 15 minutes, if you've got like a little tiny glass shot glass, don't use plastic, use stainless steel, silicone, or glass, and just say, hey, let's do this, and make it a game, make it positive. And you could have siblings do it. You can have mom and dad do it, and you may role play and feel like a dork and go, oh, honey, this tastes so good. Gunk. Oh, I love that. More is caught than taught. So practice that in times of non-conflict. And if you can get an ounce is not much, or even a tablespoon, half of an ounce, every 15 minutes during the day, just chunk, chunk, chunk. I would do that, and that's something you can do for hydration.
I love that. I love that. Very practical. Okay, so can we talk a little bit about, so for those of you who may be listening to this and like this is part of your question, several people brought this question up, and so we kind of compounded it into this statement is, are fresh milled organic grains a better dietary option than gluten-free for neurodiverse individuals?
That's a great question. And many people look at einkorn grain, which is a European grain that is an ancient grain, but there's really, we think we're doing a good thing, but when we think about a food plan for life, for the entire family, you want to bring in anti-inflammatory foods. We know that gluten, even if you do not have genetic markers to develop celiac disease, which is it's much more common than what people realize, because it may not present with malnutrition or gut problems. It can be iron deficiency, anemia, brain inflammation. And in our practice, we've diagnosed probably 9 to 12 kids since February, and adults this calendar year, 2024, with celiac disease. So it goes on. So your fresh grains that you're milling, I would say stop buying them and stop going to the expense of doing it, because they're just as damaging as, well, maybe not with the glyphosate that might be part of a non-organic ground grain, but go with gluten-free, gluten cross-reactive free. Now, for those of you, I'm not going to spend a lot of time now explaining, but there's a huge body of literature explaining why gluten grains like barley, rye, oats, and Bob's Red Mill, and gluten-free oats is an oxymoron. All oats have gluten in them. Barley, rye, oats, wheat, spelt, and then corn, millet, and rice. Wild rice is an exception, but brown rice and white rice, those are all incredibly inflammatory. They either contain gluten or they're what's called gluten cross-reactive. The immune system doesn't tell the difference. There are several sources and references. There's that Lauren will send out to everyone, and we'll attach to the video. It's called No Pain, No Grain, No Grain, No Pain by Dr. Peter Osborne, a functional chiropractor in the Sugar Land area of Houston. Dr. David Perlmutter, who is a neurologist. It's called Grain Brain. And then we will also, this is Talk About Curing Autism. TACA has changed its name, but we will send you a little excerpt from this booklet. And if you're a part of our practice, we had purchased a whole bunch of these and we've given them all out. We need to buy some more. We give this to our new patients with autism, but we will attach an expert of this about gluten-free school supplies, because let's face it, kids with autism STEM, they eat things, they have pica, they eat non-food items, and Play-Doh is one of those, and it has gluten, and a lot of markers do too. So for children with celiac, that can be devastating, but grains that contain gluten, even if they're organic and fresh and freshly milled, are very inflammatory. And what are we trying to do? Step number one, put the fire out.
Yes.
So that's why we, and even if you saw no difference, if you don't have the precision genetics, you don't know what you don't know, but know that gluten is inflammatory, gliadin.
I love that. Okay, so the next question we have is, how can the root cause of an itchy rash on a kid, how can the root cause of an itchy rash on the arms of a child with a high histamine system and multiple allergies be determined? So we have all the things going off. What do we figure out? How do we start?
So basically a very good diet history, but precision genetics, because itching is a sign of inflammation, and the genetic panel has the inflammatory markers on it. Then a concentration of what we call glutathione, the body's master anti-inflammatory, is also on the genetic panel, and it concentrates itself where we face challenges: on our skin, in our respiratory sinus tract, in our brain, in our bladder wall, and in our gut. That's on the genetic panel. And then also what type of protection your gut generates, meaning, do you need a probiotic? If so, do you need a probiotic that doesn't release histamines? So just picking something. So you may be in actuality making your child worse by giving them a probiotic that you think, oh, I bought this is good for them. But it may be a probiotic that contains probiotics that release histamines, and the precision genetics show that. And the skin is a reflection of the gut. The other thing is, what if your child lacks vitamin A and vitamin E, and by giving those, their itchiness decreases? So we can find all those things, an itchy rash and histamine reaction, from doing precision genetics. And you may not even need to do a special stool test to look for, everyone thinks, oh, I have parasites. We can treat that easy, but and you don't even have to test. We can save you a lot of money on that one.
Yeah.
But the precision genetics tell us all of that.
Well, and I think it is something that you mentioned with the probiotic, is that people will be like, oh, this is happening, then probiotic is how I treat it. But precision genetics can actually tell you that your body actually doesn't need that, and that's not where you need to start. And that is like such a great tool to say, like, actually, your body is fine in that department. Now let's move on to the next aspect and do it, and then to save yourself time. And also, like, I mean, if you don't need a probiotic, can't you like develop like swelling and all of that too if your body has too much?
Yeah, in fact, a lot of people may take a probiotic and have more of an adverse reaction to it. And certain ones are good for some people, and some are not. And then also, when you've been treated with antibiotics, you want to use a certain type for a certain duration, and also throw in some other healing components in there. And so there's a lot more to it than
Right.
just take a probiotic. It depends what kind, how much, how often, and can you
For how
tolerate
long?
it? Yeah, how long?
Right.
Do you need one every day, every other day, 2-3 days a week, ever? Can you get it from your food? All these components are very important.
It's really good. Okay, so this one is really, I think, a really great segue. Is this person goes, I understand what you're saying about inflammatory food, but I am really concerned. And we first off totally get this concern, is that my child just won't eat. And so I think there's a deep fear of like, I'm going to starve my child. How can we support them in this?
Yeah, there's a fine line. Most children will eat after 5 days. Now, if they're not grossly underweight yet, they literally go through withdrawal if you're pulling them off of dairy and pulling them off of gluten and just the poisons that are in. And a good way to talk about it is this poison or is this nourishing? So, so it depends on the child and it depends why. If a child has PANS or PANDAS, pediatric acute onset neuropsychiatric syndrome, or pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections, and they literally have an eating disorder, it's more important to work with your provider, but do not bring inflammatory foods into the home just to get food into them, because truly you are actually doing more harm than good, because you're prolonging their withdrawal for when you stop those foods. So you need to work with a practitioner and express all your concerns and fear. We'll look at your child's growth curve, see where they're at, and you need the family to be in agreement to don't bring those things into the household because they're so tempting. And if your child just wanders into the pantry and grabs something that, oh, that's for Susie, the 17-year-old. No, you need to have a sanctuary so you don't have anything in the home that's inflammatory. All right, that's going to hurt them. So it takes 3 to 5 days, but you would be surprised what children will eat if it's all positive. Oh, this is so good for us. And you just keep saying positive things like, oh, I just love this red raspberry. It tastes so good. Look at this cherry. Oh, it's so yummy. Look at this little piece of chicken. This tastes so good. Yum, this hummus. So it's saying it out loud, what we are grateful for. It's all how you deliver it. Like, I don't want to deprive my child. I just can't deprive them. There's a birthday party. We'll make them their own little gluten-free cupcake and take it with them. And, take alternatives. We're here to help you. That's what our health coaches are for. We have plenty of references of that to help you. And that's one thing that we partner with our families to do. Like how to decrease the toxic burden and how to navigate how you work with your family. Most grandparents get it when they're like, we love our kids and we know you love them more than life. You're not depriving them by not giving them Oreos. You're hurting them, and we know that you don't want to hurt them. Help us help. We're going to bring snacks, and then we want to partner with you. And we also have lots of great resources, and you never know, those taste buds change.
Absolutely. And also knowing that, and again, building the environment like community wise and like within the family is key. And to understand that yes, there are starting blocks and there are things like we understand this will not happen overnight. It didn't happen overnight for any of us and everything. So we know that it will take time. But like I love what she said, like our coaches and our group coaching is all about supporting you on this journey and ensuring and knowing like we didn't get here overnight and we're not going to change overnight, but we can start to institute and establish really good habits around all of this. This is really great. Okay. This one I think is so we just want to know just a few of our top ones that we have in office, which are or outside of the office is um, which supplements can cause a lack. Okay, so let's go through this in two. Are there supplements that can actually cause a lack of focus in children before school? So are there supplements that we should take after school because it could cause them to be like overly calm or can actually cause hyperactivity? And then what are ones that we can have? Well, let's just start there. Are there supplements that we should be taking in the evening versus in the morning?
Well, if I understand the question correctly, many children with autism have a high amount of glutamate in their brain. So There's only one form of magnesium that crosses the blood-brain barrier that allows them to calm down in order to have good, restorative, restful sleep. So I love OptiMag Neuro after school, added to water and sipped up until bed. And there's several flavors. There's unflavored lemon lime and a berry. And these are all gluten, dairy-free, non-inflammatory. And you can put them with crushed ice, those kind of things. That's very calming.
Right. So I think the question is that are there supplements that they are supposed to take or could take that could actually cause an increase in hyperactivity and an increase in lack of focus?
Not that I'm aware of that we carry.
Not that any we suggest. So if there's some out
No.
there, there
Yeah.
could be something
No.
out there, but we wouldn't suggest
No.
anything that would cause that.
So for us, it's a balance. We don't want these peaks and troughs. We want a nice, smooth, constant delivery of glucose to the brain and the nerves for attention, focus, and concentration. And we wouldn't add anything that causes stimulation.
Perfect. Okay. Oh, but precision genetics and the order in which we layer in supplements is very important for that. Can you talk on
Oh,
that?
yes, yes. Okay, yes. If you have not addressed your child's inflammation, putting the fire out, then providing each cell with the ability to pull the glucose into the cells, that's autophagy support, and started detoxification where they're going poop on a regular basis and cleaning their gut out appropriately, detoxification, then if you add in methylation too soon without putting the fire out, it can be stimulatory. I'm so glad you phrased it that way, Lauren. So there's an intelligent sequence in the way to do it, and we go through that when you do your precision genetics consultations. And you also want things at the right time. So when you add methylation in, a methylation cream or orally, the last time it's applied later in the day should be about 2 or 3 hours before bed. It needs to all stay on the skin for 30 minutes so that it's maximally absorbed. And then you can give your child a bath, shower, sprinkler, swimming, and it's fine.
Something that I think is really important to also note, um, Google is probably not going to be your best friend when it comes to which supplements your children or you should or shouldn't take, because it is a layering approach, because we do look at precision genetics. And so that's why I was like, the question was such a brilliant question. And I was instantly like, no, we wouldn't give your child anything. But because we do take a deep look at things, that's why. Like, we would
Okay.
never suggest something that would cause your child to go into an inflammatory response, which is, we know, is the lack of focus, and hyperactivity is an inflammatory response. But if you just self-supplement, that could cause some issues.
Yeah, if you Google, and there are some very well-meaning practitioners that even based on quantitative EEGs will say, oh, this person needs GABA. But if you don't have the precision genetics and your child can't break the GABA down, GABA is converted back to glutamate. So it may work for a couple of days, and then you've got an anxious, unsettled child. And it was a very well-meaning practitioner that just didn't know that that person had that neurotransmitter problem. Now, we do have things that help with focus and concentration that we typically use earlier in the day, but methylation helps provide dopamine at a nice level amount, which balances our excitatory and our calming neurotransmitters.
Love that. What I love about that is it kind of, though we're going to talk about this next question, it also um, paves the way just to say that any of these supplement suggestions that we're saying, or we're going to talk to you about supporting, are also things that we expect you to talk to your provider about, or one of our providers about. We would never want you to just start taking anything. But that was what the next question is are there supplements that we do recommend or look into for our children who are neurodiverse?
Yeah. Well, there is something called palmitoyl ethanolamide, PEA, that if you're waiting to see us and you want to do one thing, um, PEA is one biochemical step away from a naturally occurring anti-inflammatory called anandamide. And it is very calming, and it helps not only in the brain, but also in the gut. And that can be used. And most of the time, providing your child with a high quality fish oil or a high quality borage oil is very helpful. But as far as spending any money on anything and you're just guessing, please don't guess, test. And know that when we do these precision genetics, many of them act synergistically, meaning you'll go from A to B with just PEA, but you may go from A to C with PEA and a whole molecule curcuminoid. Okay, so they help each other, and that calms everything. And so please don't guess, and please partner with your medical provider, and don't try to be Dr. Mom. There's even some websites that sell some wonderful supplements and things. But when you have the benefit of the precision genetics, and we have the benefit of your child's medical history, and when things happened, then adding things, right time, right place. And the point is, do no harm. And then and we need to work with you. And many times people will think this is causing X. And it's actually not that. It's that your child may be getting sick, or they have another medical condition that's been undiagnosed called porphyrin dumping. And we have to test for that. And we may need to slow things down. So it's much more complicated than take this, then that.
Mm-hmm.
So.
No, I love that. Okay, so we're going to now transition into therapies and interventions. So I'll just say off the bat, we are not anti other external therapies. But again, what I love that you brought up right now is that intelligence sequence. So the question is, what are the benefits and drawbacks of brain balance therapy for children? But before you dive into this, is what you're going to say is kind of for overall kind of therapies before you start diving in and spending money in ABA therapy, something like brain balance therapy, or any other therapies. Again, intelligence sequence. Can you talk about benefits and drawbacks of what that looks like?
If your child has an inflamed body, brain, and gut, any therapy that you attempt may not be received or be able to even be incorporated. So before you spend a lot of money on speech, OT, PT, sensory integration, brain balance, please work with our practice, work with a practitioner that can look at your child's precision genetics, get the inflammatory burden down in their brain and their body so that they can actually have the ability to learn and receive. Because if you're using all your metabolic energy to put the fire out, what kind of energy are you going to have to learn? Okay. And you're going to feel like I'm wasting my money and my time in many ways you are. So brain balance is an excellent augmented therapy, but without the benefit of the precision genetics, like we talked about, you want to be incorporating all of that, opening up all these pathways, lowering inflammation, giving good autophagy, detoxifying, adding in methylation and mitochondrial support before you start doing that, so that all your child's energy, when they go to brain balance, neurofeedback otherwise, will be received and processed, and your money will be very well spent, and you'll get this huge return on the investment because you chose at the right time, the right place, the right amount to add that
Right.
therapy in. That's a
Right.
general principle that you should remember.
I think that's really important. So the next question is about, I see y'all post about functional therapies within your practice a lot. Um, is this something that could help my neurodiverse patient? I'm going to break it down into the three main therapies. So first, I want you to talk about IV therapy. And could this be something to help a neurodiverse student or patient?
Yes, very much so. But again, and I know I'm beating a dead horse here, but we can make a IV drip for your neurodiverse student. Also, we have situations where people are having surgery and we want to help them detoxify from that. So we have some standardized drips, energy, focus, restore and optimize, detoxification. But when it comes to neurodiverse patients, we tailor it very much so. And then yeah.
Yes. And I just want to repeat what you're saying is that though we do have standard drips and we love our standard drips, we would suggest anybody to come in for those. When we're dealing with a neurodiverse student, it's important that we have our patients have precision genetics so that we can tailor that drip to them.
Yes, so we can put in what will help them and to be cautious with things that won't. So you may walk into a med spa and they give you their amino acid concoction, but it's got glutamate in it. Or, and it makes you nuts because you have that glutamic acid decarboxylase thing. So this is the difference. We know your child's needs and we want to tailor what we put into it to help them so that you don't have an untoward side effect.
Oh, I really love that. Okay, so let's go to I feel like a little bit less invasive in the sense of no needle treatment. We talk about insufflations. How can insufflations help a neurodiverse student, or can it?
Yeah, so ozone is what Lauren's referring to. And I don't know about you, when I first heard about it, I'm like, okay, they tell me on the weather the ozone layer is being
Right.
degraded by the pollution in Houston, stay out of the sun. Well,
Right.
ozone gas is a very reactive gas and you don't go inhaling it. Okay, but that fresh smell when you come outside after rain, when lightning hits the earth, it makes ozone. Ozone is very rapidly converted to something called an ozonide. So when we take ozone gas and we put it in the ear, when it hits protein or fat or goes through the eardrum, right next to the brain, it allows the mitochondria to use that supercharged ozonide to make more ATP, which gives your child more brain energy. So ozone does many, many wonderful things, but and even investing in a lifelong gift of an ozone generator at your home, that is a therapy that you can do at home that will help your child all the time. And it can also treat infections. So what does ozone do? Delivers oxygen to the mitochondria so they make more ATP, so they have more brain energy to learn. If they have any brain atrophy, it can increase brain size and restore volume. It can help with speech, concrete to abstract thinking. It lowers inflammation. It can treat infections. It helps the body make more glutathione. It treats infections. It helps produce something called hemooxygenase that lowers inflammation. It decreases free radical production, and it's a powerful antioxidant. So ear ozone can help your neurodiverse student with focus, concentration, behavior, speech, thought process, brain growth. It's a wonderful therapy.
That's really great. And the reason why I said, not that any of these are like extremely invasive, but it is done very simply. I don't have like the tube. Do you have one with you?
Here's an ozone syringe.
There you go.
You put the ozone gas in it and you put it in the ear, and then we hold the ear for 10 seconds. We do it 3 times on each side. And That's all it involves. And it's a wonderful therapy.
Absolutely. Well, and what I love so much about it is everything you just said. It does so much for something so like simple and like and that. So okay, the next therapy is blood ozone therapy. So IV ozone therapy. And so can that help a child? What are some like kind of take us through that process and what to be aware of whenever a child who is neurodiverse starts a therapy like that?
Well, any therapy, you need to determine the child's ability to receive the therapy. If we uncover that your child has an infection like Lyme disease, Bartonella, Babesia, maybe they don't tolerate herbal drops or oral antibiotics. By doing IV ozone therapy, that can eradicate it. We've had a young adult patient that is on the autism spectrum that was unable to tolerate herbals and had some other issues, and the ozone eradicated the infection. And but they did very, very well with the IV therapy. The youngest, I believe, that we've done IV ozone therapy here in the practice is age 5 or 6, around in there. We had recommended it for a child with a pretty severe infection that was less than 3. Haven't had follow-up from the family.
Right.
But it's, we have we have pediatric IV nurses, and just recently we invested in having a gentleman who is world-renowned that is called into hospitals to lower infection rates and teaches doctors and nurses, and he trained our nurses with ultrasound to find vessels in people who have very bad vascular access. And the fact that our nurses are pediatric trained, I mean, what better combo? So we're patient. You come in, a little bit of blood is taken, diluted in some saline, and then we put the gas in with the blood. The red blood cells absorb the ozone, and then the saline blood mixture is infused back into the body, but we treat the blood with ultraviolet blood irradiation at the same time, especially with infections. That's another therapy. And then we do IV therapy right after that to lower the inflammatory response as the body is killing organisms and things like that. So that's another way that we treat that.
I love that. And so that is, and what is it's like if you could just bullet point again, I know you kind of touched on it, but bullet point again, or what are some of the benefits of that therapy for children who are neurodiverse?
It directly kills infections, bacteria, viruses, parasites, single-celled yeast and fungus. It increases glutathione production. It lowers inflammation. It provides supercharged oxygen to red blood cells. It lowers hemoxygenase, which is inflammatory. It stimulates and then decreases stimulation of certain parts of the immune system. It eradicates cancer. It's very well documented. There's a little book called The Ozone Miracle by Dr. Frank Schallenberger that will tack on the link to that. And then there's a huge plethora of literature on the American Academy of Ozone Therapy and a document called the Madrid document, or the Madrid Declaration. So it's extremely well studied.
Thank you so much. So it looks like we are at the end of our time. So what we're going to do is, though we won't have another live event, we are going to have a recording where Dr. Kay and I will talk about language and learning, behavioral and emotional support, and we'll be loading that in addition to this video for those of you who need a playback to this video. And so we'll be talking more about this topic. We understand, man, y'all had so many questions. And so we want to address your questions and support you guys as we come along. But thank you so much, Dr. K, for all of your help and really taking the time to explain to us so much. And again, as y'all have questions, you are welcome to message us on any of our Instagram or social media platforms. But thank you so much, Dr. K, for your time.
Thank you for hosting, Lauren. You're the hostess with the mostest.
Bye, everyone.
Bye-bye.